We are taking a look at today's Health Watch for you, and we want to take time to talk about heart health in February. We know high blood pressure, cholesterol, smoking, all prevalent. Almost half of Americans have at least one risk factor, and 1 out of every 5 deaths in the U.S. are due to heart disease, and that is according to the CDC. Joining us now to explain a little bit more about what we can do to better protect our heart is Dr. Lindsey Fish with Denver Health. Thank you so much for being with us.
My pleasure. Thanks.
We always look forward to having you here on Thursdays to keep us healthy. So let's talk a little bit about American Heart Month and why is it so important?
Well, as you already mentioned, heart disease is the #1 killer of Americans, unfortunately, and American Heart Month is a great time to remind ourselves to check on our heart and make changes. So much of heart disease is preventable, and that's what's so important about it. And most of the risk factors don't have symptoms. And so little changes can make a big difference, but we really need to be aware of what we need to do.
Let's talk about those risk factors. What are they?
So the biggest medical conditions that we think about are high blood pressure, high cholesterol, and diabetes. And all of those don't have symptoms unless you get tested.
Oh.
Then we know obesity is a big factor as well. So lack of exercise, poor nutrition contributes. Vaping and smoking, unfortunately, affect the vessels of the heart very much. And then things we don't even think about, like getting enough sleep is important and managing our stress. Not enough sleep and too much stress also affects our heart.
Yeah, we're starting to read a lot about that these days.
Yep.
Let's talk about the warning signs. You know, you're saying some things you don't know until you get tested, but is there something that your body might, a sign that it could show you if it's under stress?
Yeah, I think the most important thing is if something, happens suddenly and is severe, that's your cue.
Okay.
The key things we really talk about are chest pain or pressure in the chest, especially if it's with exercise or stress. If that pain from the chest goes up into the neck, the shoulder, or the arm. If you have sudden shortness of breath, dizziness, or fatigue. In women, we often see subtle symptoms that are a little different. So in women, sudden nausea or vomiting are other things we worry about. And the key is just paying attention to your body. If something changes suddenly, you should listen to that.
Really pay attention. What are some simple steps that we can take? It's just something we can start immediately to make some good heart health choices.
Yeah, so these are things I feel like I say so often, but it really does need reminding for us to remember to do them. So 1, go see your doctor. Get your blood pressure, your blood sugar, and your cholesterol checked. There's no symptoms for those until you have problems. We want to exercise 150 minutes a week of moderate exercise. We want to eat healthy. So I always think about lean proteins, fruits, vegetables, whole grains. Really look out for the processed food because so much sodium, salt, and sugar in those. Sleep enough. Adult needs 7 to 9 hours a night. And manage your stress. Figure out what works best for you. Exercise, social connection, meditation, and really pay attention to that. It's really important.
Yeah, keep that blood pressure down, right? The best that we can. Dr. Fish, thank you.